Finding the Voices.
Talk show by Monica Igudam.
I'm a huge fan of Finding the Voices.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Been finding voices on
people from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
So you mentioned about vasectomy.
Yeah. Oh yes.
For the male.
I love it. I love it. Because
so what is the percentage and?
Yeah, it's around 5 to 10%. At some point of time, it was drastically increased also because again, earlier we can do very openly, but now activists says don't do it. So
for male also.
For male also.
Okay.
So, but especially those very high-flown people, engineers, IS guys, and those things, they invite me and they kindly do it, and I'll give this much of money, and and of course I do sometime in CRPF camp and Assam Rifle camp. I do. But this is also very interesting, I was attending a conference for all India Family Planning Medical Officer Conference in the Hyderabad, in the Hyderabad house in Delhi. I met one Professor RCM Kaza. He's an under guy, he's a very unappealing, dark, long hair and all. And I was saying, I'm a gynecologist, but I was doing vasectomy, I want to learn it. So I said, come to LNGP, Long Niger Prakash Hospital, and I'll teach you. Then I went there, I started learning. Then the UNAPA started suddenly because male also contributed reproductive right. Male reproductive contribution is on because a reproduction is a male and female contributions. Right. Not only female cannot have the baby, not only the male also. That's it. Two ways. So government of India, the UNAPA, United Nations think that male also should contribute something. So then the China, the beginning of Professor Li Kuang, he's from Chengdu. He started this operation: no cut, no bleeding, no stitch. No pain. It is a very simple 5-10. Of course, a little bit of experience. Then I say, oh, sir, I want to learn it. Then I went to Delhi, I spent 2-3 extra days to learn this technique. Personally, no government support. Okay. I went
because
personally.
You were very
I interested in family planning, as I told you so many times. Then I became a deputy director of family planning, and the government of India says that if somebody want to have this thing, and kindly submit it, and I submitted. Then Professor Kaza come, then it became popularized. Dr. Rajan, the urologist, also trained. He went to China, and there was a very lavish. I spent it. I enjoyed it there also. But I come back. It started. Then it was coming up around 20% of this lesson was male. Then suddenly in Manipur.
So is there any compensation? From the government?
They have got more money. They got around.
So I see. So the government actually compensate more to
money,
the male to
promote,
encourage
male sterilization. Exactly. And even the person who accompanied with him, one of his crony, we give
the person who gives. So how much is the compensation?
I think 1,500 or so.
And for the woman?
For the woman, around 1,000, a little bit less or something like that. I couldn't remember exactly, but definitely male. The government of India says you male also do it. The reproductive is not for only the woman should have a child. They will have the pain, and you cannot bear anything. Then nothing is wrong. But it is a quite simple operation. For the woman, it's a laparoscope is a huge instrument puncturing to the abdomen, but for the male it is a small incision, a small nick at the skin. So it is a very simple operation for the male. Female is a very complicated operation.
Okay. But it is not adopted widely in Manipur or in other places in India.
Yes, again there is a place called Karimnagar in Andhra Pradesh. It is around 60%, 70% male contributions.
I see. So there are places who have adopted, but in Manipur it has not.
Yeah, and very strangely, last time it was in Australia, this time in Bali. I was one of the member of all the world vasectomy surgeons conferences going on. My name has come up in the internet also from India, and there and net cast also they was doing it. And very strangely, it's so nice. Husband and wife come with their child, and the husband is lying down. They are doing the operations, and the wife is holding his hand, and it's just sort of a very romantic. I think it's such a wonderful feeling, but I think it will take some more time for us. Husband and wife come with one child, and the male is lying
they
down.
Encourage and they adopt.
And the guy was very proudly say, I'm contributing something for my wife. I'm happy. Oh, that's great. That's simply great. That's a wonderful feeling in my life.
So why do you think in Manipur particularly that it's not adopted by the male?
Yes, again, there was a little bit of race, but again,
is it the lack of awareness, or is it
no, because again, women thinks that if my husband is vasectomized, if he became weak, and he's the bread earner, this is very common
but
perception.
you said that it's a very simple procedure.
But no, it is a psyche.
Yeah, I know, but so what I'm trying to, I guess, point out is it's the lack of awareness to the public, because you have said that the procedure for the woman is more, what do you say?
Yes, but
more complicated than the male. So
I agree. I have done very good number of operations in my friends, and they are very happy. There's not much a problem. But again, the education, or more or less education and civilized. I don't know. I can't say the word civilized, but very strangely.
It's the thinking. Like traditionally,
thinking,
woman has done it, so woman continued. But we should encourage male also opt for it.
Yeah, it's very strangely more developed, more contribution of male family planning. More developed.
You're saying that in more developed countries and places, you have seen the number of males opting for family planning. The number is higher.
Yeah, again, I was in Europe for 1 year or so, but for the family planning, we have to counsel him for 3 months.
Okay.
3 months window period they have given it, because this is the permanent method. You cannot reverse it. You may be remarried, because they have got a chance of divorce, and remarriage is very common. So we have to give 3 months time window period to think of it. But still they say, okay, I'm coming, no issue.
Oh, so you actually give them time to think.
Yeah, but for us, we do here, so immediately then and there. But in developed country, we give some 3 months counseling, of the post-operation counseling also, because there's a very lengthy one. But of course, I do admire for them, and very expensive. It costs around 40,000 rupees. Have to be wear by the guy, not by the government. They have to pay me.
In the outside, outside of India.
In Europe, I'm talking about German. I'm talking about Holland. German, I was doing something. They give me so lavishly, because 3 months counsel. They make an appointment, send my ticket, put in hotel, do the operation, go back, take the money. That was this thing. But of course, there is something like a big dream. But of course, I do have a wonderful memory of my life in Europe. It's a great country, but even to them also, they have got certain issues are there. Should be done, should not be done.
I have learned that you have gone to Europe for your fellowship organized by WHO, specialized in the reproductive life. So can you share a brief experience about your stay in Europe?
Yes, that was a very melancholy, very lovely time in my life. I'm very fortunate. God bless really to me. That was 1990s. There was a meeting at Vigyan Bhavan for at that time, Reproductive Child Health, RCH. Now we call it National Health Mission. In those days, Reproductive Child Health was there. So I was presenting some fact and figure of Manipur as a deputy director in the family welfare department. And one fine day, one of the team member, his name is Binod Diwan. He's from India, but he's settled in Sweden. He's a professor in the Konerski Medical Institute, something like that. I couldn't exactly remember it. And he says, Sam, I want to come to Manipur. I want to have a look about the childbirth areas, how the women are delivering, and how things are happening. I want to have a look. And Of course, we'll pay everything. Don't think that we will get some. We'll arrange everything about financial part, but kindly organize for me. I say, okay, welcome. So then one fine day, one fax message come from the that is called European Preparatory Commission, EU Preparatory Commission, European Union Preparatory Commission. There he was the leader, and he was he want to see the Manipur. And as usual, I enjoy people. I am very talkative, and I love to guide them. I have gone to Lilong, Sugnu, and some part Jenims also, and Rims also. At the time, that was
how many people came from
it's
Switzerland?
around 7, I believe.
Okay.
2-3 people from Sweden, and 1 or 2 from Ireland also.
Okay.
And one is from UK, because they are interested about how much of reproductive right, how much of women are getting the facility of childbirth.
In Manipur.
In Manipur.
So you took them to all the district of Manipur.
Yes, most of them. And there was all this hospital was there. The pathetic condition of birthing areas, very dirty, not very clean in those days. And the baby resuscitated after the child is born. Baby have to be resuscitated because you have to start his breathing. All those suction machine and endoscope and things was not available.
Okay.
So he don't talk too much, and he realized that.
There was a big gap in the technology as well as the
exactly.
cleanliness of sterility of the patient.
Yes, and the World Bank and all, they have given money. Then we started, because I was talking about giving money to the delivery women. There was no money for the childbirth.
Okay.
So because they are the funding it, they are the backbone of this organization.
Okay.
So then he asked me, did you ever went to WHO fellowship? No, how I can be. I'm from the remotest corner of India, and who care? Nobody is there in Delhi to look me. No, you deserve. You work so hard, and you are so informative about the statistics, and you have shown the real thing. Some people try to show all the good thing, but you show me all the realities and. Okay, fine, thank you very much, and I'm afraid I will not be able to get it. And I forgot it, and I was keep on doing my job. And one fine day, one Commissioner of Health, his name is DV Singh, a lovable gentleman. All the time smiling, and he's ringing me up. Hey, sir, he said, sir, I got an assignment to Europe. I say, I don't believe it, sir. Come, believe your one eye. Come. Okay. And I just rush up, and he was just throwing the paper to my face. Make 100 photocopies. Manipur is notorious for losing papers. I say, I just have a look, and the numbers around 60,000 rupees. My goodness. At the time, I was getting maybe 35 or 40,000 rupees per month in those days. I was, my goodness, and I don't believe it. I was just laughing, and is it really a cruel joke? I was just looking. And I said, no. Do it now. Do it sincerely. Follow the instructions what they says. It's a very good exposure. I do not know at that point of time what he was telling. It's a very good exposure. After completing my course, after exposing myself to Europe, I know that I learned.
You learned a lot.
Yes, and it was a very good exposure. That's why I got an opportunity to talk to you in front of you. Such a wonderful lady in front of me. So that was the word. It's a good exposure. It was a very real fact. I really respect, and I really indebtedness to the rest of my life to him.
Because of the study, as part of your fellowship, you got the international background for family planning, reproductive rights, and everything.
Monica, Finding the Voices.
Finding the Voices.
Finding the Voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government, in the system, that yes, it's working.
Let's bring peace in our home state, Manipur.
We have got the job without bribery. They will do justice to their job, and they will help raise the standard of Manipur.
me ma chen kre ha do ai adu paraga tingau gi
And I fly down from Imphal, Delhi to Paris to Rome, by Air France, and they put me in a hotel for some time, and I meet one of my guides, a wonderful lady. Her name is Serena Donati. She is also MD gynae, and she is specialized in cancer cervix. And she also has same wavelength with me in public health and family planning and cancer cervix. Although she is a gynecologist, like me, she also have a very fond of women right. She worked in Palestine for some time in UPA, and she loved. She is more or less very rich. Only one daughter is there. Her husband, the BMWs, the dealer and all. Money is not an issue for them. And she like to work for the developing countries and all. She come twice also in Imphal, and she talk in the Indian Medical Association Manipur branch also. So she was, we click each other, and very strangely, another woman come up, a young girl, and her name is Romina. So she is a dental surgeon, but her thesis was knowledge, aptitude, and practice of antenatal, intranatal, postnatal care among the immigrant women. Because some Bangladeshi women die in childbirth at Rome at that point of time, around 2-3 years, because they are illegal immigrants. They bring
so they were not coming to the
hospital. They deliver their baby. It's happened in Bangladesh, it happened in India, in a remote part of developing countries. Their husband and their relatives, they deliver their sisters. So, as you know, for every 100 deliveries, around 10% will have the complications. Bleeding is a common phenomenon. Some of them must be having bleeding, and she died.
And there was no doctor to assist.
No doctor to assist. Then at the time of burial, they have to inform the police. Cemetery is a very, very lengthy documentation is required. Where he died, where the death certificate, and things like that. Then the pop-up, they are in Europe. I have learned that this recording, the informations have to be in tip-top.
So the process of documentation and statistics
very
is very
important.
good.
Yes, very good. Statistics information is tip-top. So then they cannot bury because they don't have documentation. Then the police come, and of course at the end of the day, they have got their one system of doing this thing. Then there was alarm bell was ringing. So women are dying in Europe in childbirth. We should stop it. Irrespective of Bangladeshi, irrespective of Indians, irrespective of South American, irrespective of Filipinos, they should get at par. Any pregnant woman in Europe is a woman, have got a full right to access the hospital. So then she cannot speak Bengali, but somehow or other I speak a bit of Kemonase and things like that. So we three working together very hard, and her thesis was that thing, and mine is that clinical side. I was working with them, and very strangely, in Europe, even in Europe, family planning is a big taboo in Ireland and in Italy also. Abortion doesn't allow still in Ireland. But still, there was some point of time Italy was not allowed to do abortion. They have to go either to London or Switzerland by year, do the abortion, come back. Then all the women folk of the Italy come up to the Pope, you cannot stop aborting us, by ourselves. So we are spending money. It is not good. So Pope select few doctors to be, abortion should be done under them only. So suppose if I do abortion at Rome, I be penalized for 4 years imprisonment. But of course it is never done in India. But again Ireland, one young lady died, Indian doctor died, because her baby fetus was pulsating, heartbeat was there, so they cannot do the DNC, the evacuation or so-called abortion. So the woman dies. It's so pathetic, but still they cannot do the abortion. Again, a ship come from Holland, the name of the ship is called Aurora, A-R-O-R-A. The women from Ireland, they go by small boat, go to the big ship, do the abortion and come back again, but still practicing it. Even in Europe, even in America, Some doctors were killed by a fanatic because he was practicing abortions. And of course, Catholics are deadly against it. Some are pro-abortions, some are not pro, against abortion. So in America also this is happening. So that was my little bit of exposure of my European experience. Of course, academically, they are far better than us, not out of it. And before I forget, I really enjoyed their art. Michelangelo's, Leonardo da Vinci's, Florence, Venice. Oh my goodness. Their paintings are
so you got an opportunity to see.
Yeah. Florence, I spent many times. Statue of David, the marble structure, I just touch it as if he's alive. That much of the vein, the artery, as if it is alive. And the paintings, Michelangelo's paintings, Sistine Chapel's painting of Rome. I think I request to my all colleagues, to my friends, that one should go to Rome and Italy. You should enjoy it. Of course, you love the art and all. And again, coming back to my profession, they started dissecting human body in 1590. Leonardo da Vinci, they started digging out the bodies from the grave, putting in the stream, started cutting and showing the heart. They are painting and they documented it with painting. It is almost 100% correct. Even they dissect a pregnant woman with a baby inside the uterus and they draw it so nicely. It is at par, excellent.
With what you have learned now.
Right now.
So you are so amazed that at that time in the 1500s, they already are aware of the anatomy of the woman.
Exactly. At that point of time, I worried perhaps we were not wearing clothes. to be honest,
they were so much ahead.
They are so much of advance, and of course, their Mediterranean climate is perhaps the fish, the red wine, the crabs.
So you got exposed to different food and their culture, which you really enjoyed.
Lovely. Pasta and pizzas and whatnot. Very healthy food. They ate very healthy food. A lot of olive oils, a lot of fish, sardine. Of course, sardine is a poor man's fish. It costs around 250 rupees per kg. Of course, it is compared to Manipur, it is a little bit expensive. But I got 60,000 rupees per month and 30,000 or so in my maintaining my quarters, and the money was not an issue. So anyway, coming back to that, I learned the subject well, and I also know that how far advanced their civilizations at that age, and I wish that one should expose it to at least once in their lifetime.
Thank you for sharing that. So coming back to what you have learned, I have a couple of follow-up questions. So you spoke about abortion and abortion rights. I have seen, like in America, I know, like you said, that it's a personal choice whether you support abortion or oppose abortion. But there are initiatives where, say, the girl or the woman doesn't want the child, then there are initiatives wherein they can have the baby, but they give the baby for adoption. So is there any initiative in similar line in Manipur or in India?
Adoption.
Like encouraging the woman or girl who doesn't want the child, who wants to abort, but have the baby and give it for adoption.
Adoption illegally we are continuing it, because I'm sorry to say it, because it should be under the government rule. One should know their parents, it should be documentation should be there. But nowadays something like a 8-month pregnancy, a woman come, a young girl come, brought by his mother, by her mother. Said, "That's kindly abort it." I said, "No, I cannot do this. It is already, if I take it out, the baby will be alive. I cannot kill a human being. Abortion 2 months, 3 months is okay, but up to 8 months, then it will be unthinkable. It is but some of the patients which I treated, because they had infertile, they got married for 4 years, 5 years, they couldn't have a baby. They say, "Sir, why don't you give me a baby? Because you must be having some of them must be coming." And I say, "Okay, fine." So I'm talking about it is illegal thing. But if I ask to the mothers of the young girl, they would not say, "No, I cannot disclose this thing to the government or to the women welfare." We have got the social department, social welfare department. They have got one cell. They have got one way of doing it. But I'm sure 90% are not doing it.
So what I'm hearing is people who want to do abortion, there is no consultation or there is no initiative that maybe there is an alternative wherein you can have the baby. Like, I'm talking about people who don't believe in abortion.
Yes, abortion is a very critical issue, but the adoption also a critical juncture, because the rule says that one should legalize it with the government channel to the social welfare department, but it is not practicing at all, because I'm 35 years in my job.
So what? Yeah. So you're not seeing that channel at all.
No.
Okay. So it is like, okay, if people come, they want to have abortion, then there is no consultation of any other alternative. They are aborted.
It is happening. The adoption is happening, but it is not the legal channel.
Okay.
Is not doing illegal channel. I must have given maybe around 6 or 7 child to the infertile family. Those doesn't have a child. But I am doing illegal thing. I am telling again. But of course, it is beyond my capacity. The parents, the mother, the woman who bearing this child, he said no. I cannot disclose my name to the government because this is a private.
Right.
Private personal life.
So what you're saying is, you have had instances like the example you have given where a girl came with, who is 8 months pregnant, but they want to abort it. But then you also knew another couple who was infertile.
Oh yes.
So you informally mismatched them.
Right.
And so that the other person who wanted to abort gave birth to the child, but the child went to a family.
Yeah.
So this is happening, but it's not in a legal or processed ID.
We have got department, social welfare department. They say very clearly, somebody want to adopt it through our channels. Because if something come up, suppose the baby is taken by that family, if they started torturing the baby.
So there is a channel, but nobody wants to use it because they don't want to give out their name and privacy and things like that.
They don't like to disclose it.
Okay.
6, 7 I have given it, and I hope, and I'm sure I personally know them, but so far they don't do torturing. Somebody you have seen somebody WhatsApp, and some women are beating the one young child, and later we come to know that that baby was adopted and from one of her sister's child or something like that. Perhaps you might be listening it very recently. Okay. So that is very unfortunate thing. But to prevent it, the government of India, government of Manipur is giving a window opportunity to adopt her and to give her also. But again, they are not utilizing it. But somehow or other.
Okay.
Somehow or other.
So in your career, you haven't seen that process?
No, never.
Never.
Okay. Never. But I'm telling you a very, very strange story. Give me half a second. The lady's younger sisters have an affair with her husband, so they conceive. It is going to be full term. Both 2 sisters and the gentleman come and they say kindly abort it. I say no, nothing doing. And the elder sister, sometimes she was treating her younger sister so nicely, and sometimes beating also, feeding nicely and beating. It's a mixed feeling because she doesn't like her sister to be her husband's wife. I'm telling the real fact, and I had a tough time to console the emotional outbursts of these 2 women. So at last I delivered in a private hospital. Then somebody come up and we would like to have it, and all, of course they adopt it. She was a nurse, adopter was a nurse. After some 2-3 years, they also have one more baby, the adopter. They live very happily. I went there sometime and I never uttered a word. I have a cup of tea and these things.
You maintain the privacy?
Yes. This is very, very important. Of course, in our medical ethics, somebody's privacy, and again in modern life, in modern days, privacy is a paramount.
Especially in your field.
Yeah, paramount concern. Paramount concern. Some of them, have a woman having a relationship with other guy getting married, and please don't disclose this thing. So we have to keep our mouth shut because this is somebody's private life. We never ever interfere somebody's private life. It is our medical ethics. We never should utter this word.
Thank you for sharing.
Yeah.
Please do
Voices.